Hello viewers, I am Dr. Rahul Reddy from ANDROCARE Andrology Institute. Many patients ask me to show how the shockwave therapy is given, how the shockwave therapy mission looks, and what are the parts of shockwave therapy. If you see comments, there are so many questions regarding this. So now in Telugu channel, I think I did multiple videos regarding this shockwave therapy mission. So I think for English channel, this is the first video. See, this is our workhorse. This is our Wolf's Piezo Wave 2 mission. This is called Piezo Wave 2 Shockwave Therapy, Low Intensity Shockwave Therapy Mission, and this is the company name. It's Wolf. This is a German company, and it's at present this is one of the best shockwave therapy mission which is available in the world, and this is a second generation Piezo Wave 2 mission. And in Piezo Wave in shockwave therapy technology, now we divide it into three categories: first generation, second generation, and third generation. And there are two types in that: linear shockwave therapy and focused shockwave therapy. So now first generation ED1000 and other small machines companies used to be there, and after that other companies like Renova, they used to come. See, first generation machines are electro hydraulic, second generation machines are electromagnetic, and third generation machines are piezo wave technology. So this is more beneficial to the patient, and one advantage with this is, now in other machines we used to give only 1500 shocks or 200 shocks per session, but here we can give almost 5,000 shocks per session. That is the efficacy of the machine. And in spite of taking, see, previous machines, if patient takes more than 1500 shocks, there used to be some heat on the penis. But here, even after 5,000 shocks, generally there won't be any heat or any irritation to the skin. We have this machine since last 3-4 years, and our most of the patients are very happy, whether it is erectile dysfunction, whether it is prostatitis, or whether it is Peyronie's disease. Most of the patients are happy. Initially, when this technology came to India, piezo wave technology, most of the people did not believe that this will work, because we tried other therapies before that. Actually, I took this mission only for prostatitis. Then later on, I saw good results with prostatitis. Then I started using it for erectile dysfunction, Peyronie's. Even Peyronie's disease, most of the patients are very happy with Piezo Wave 2 therapy. So if you see the machine, this is a trolley, and this is the main machine, and this is the applicator and shockwave generator. Here the main, this is only a machine, but the main probe here, you have shockwave generator here. This is more expensive part of this machine, and this is very expensive, and this comes for only few shocks. After every 1 lakh shocks or 2 lakh shocks, you have to replace the probe, otherwise it may not work. So now these are the applicators. So now, depending on the patient, depending on the therapy what we do, whether it is erectile dysfunction or prostatitis or Peyronie's disease, we have to choose a different applicator. This is only a rubber which sits here. See, generally if it is prostatitis, we use this. If you see this, the depth of penetration is more, so it sits here. We have to put a jelly. Yeah, it sits here, and once we start shock waves, this is very simple. And there is a button here, you can hear the sound, and this is to improve and increase and decrease the speed and power. Now if I increase the power, then I feel something is slightly touching my hand. this is how a shockwave therapy goes into the body. Actually it's safe, it's painless. Even if you put it on the penis, this is how we give it to the penis. Generally what we do is each sitting, for if it is erectile dysfunction, we will give 5000 sessions. If it is prostatitis or Peyronie's disease, we give around 2500 shocks. So now if this is the penis, based on the penile length we have to select the applicator. And second one, if it is prostatitis, if you see the numbers are here, it tells us about the depth of the penetration. So if penis is thin, then even this is enough, 5. So 5, 10, 50, this is 15 and this is 20. But for prostatitis we use this. For Peyronie's disease we use the lesser one, and for erectile dysfunction we can use either 15, 10 or 20 depending on the depth or thickness of the penis. So we give 3000 shocks on the penis, they keep rubbing like this, and remaining 1000 shocks on the crura, the inner part of the penis, that is where we have to give. So each session will go on for around 30 minutes with this piezo wave 2 technology. So now for if it is prostatitis, then we have to give only 2000 or 2500 shocks depending on the severity, whether there is prostatitis or seminal vasculitis. We keep changing the number of shock waves, and even the angulation will change. If there is prostatitis, one particular area we give. If it is seminal vasculitis, then we have to keep moving that to give this shock wave therapy. Generally these shock waves are painless. If you see, I am keeping my hand here, I am not feeling any pain or any touch sensation. So you don't have to worry, there are no side effects. And some shockwave therapy machines, there is heat. After some shock waves, they start noticing some heat on the penis. Here that kind of heat is not there. Okay. So now if you have any questions regarding shockwave therapy, you can ask in the comment section. We have one more machine which has come for demo. This is Modus. We are actually trying this. Next video I will tell you about that particular machine. Thank you.